السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك. Review of Prometric Test Question. This is lecture number 4 in care of the newborn. Today, inshallah, we're going to discuss 5 questions from question number 129 up to question number 133. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 129. The nurse assisted with the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? The options are number A, warming the crib pad, number B, closing the doors to the room, number C, drying the infant with a warm blanket, number D, turning on the overhead radiant warmer. وقف الفيديو هنا واختار الخيار بالشكل الصحيح. The correct option is option number C, drying the infant with warm blanket. نشوف rational. Keeping the newborn dry by drying the wet newborn at birth prevent hypothermia via evaporation. Because evaporation التبخر بتاعت الرطوبة والمياه الموجود في جسم الطفل moisture from a wet body leads to heat loss. So the correct option is option number C. Drying the infant with a warm blanket. Warming the crib pad regarding the option number A, assist in preventing hypothermia by conduction or via conduction, and closing the door to the room regarding to the option number B is assist in preventing hypothermia by convection. دي كل طبعا أنواع من أو طرق بتاعت فقدان الحرارة. Evaporation, conduction and convection. Turning on the overhead warmer اللي هو option number D, دي عبارة عن treatment measure for hypothermia. So the correct option is option number C, which is drying the infant with a warm blanket. Question number 130. The mother of a newborn calls the clinic and reports that when cleaning the umbilical cord, she notes that the cord was moist and that discharge was present. What is the most appropriate nursing instruction for this mother? The options are number A, bring the infant to the clinic. Number B, this is normal occurrence and no further action is needed. Number C, increase the number of times that the cord is cleaned per day. Number D, monitor the cord for another 24 to 48 hours and call the clinic if the discharge continue. وبها الفيديو هنا اختار الخيار بالشوف صحيح. The correct option is option number A, bring the infant to the clinic. ليه اخترنا الخيار كمان؟ نشوف rational. Signs of umbilical cord infection are moistness, oozing, discharge and redness based around the cord. دي علامات بتاعت اللي هو umbilical cord infection. If signs of infection occur, the client should be instructed to notify a healthcare provider or bring the infant to the clinic. So the correct option is option number A, which is bring the infant to the clinic. Option number B, C, and D are not the most appropriate nursing intervention for umbilical cord infection as given in the question. Question number 131. The nurse in a neonatal intensive care unit, NICU, receives a telephone call to prepare for admission of a 43-week gestation newborn with a CAR score of 1 and 4. In planning for admission of this newborn, what is the nurse's highest priority? The options are number A, turn on the apnea and cardiopulmonary monitor. Number B, connect the resuscitation bag to the oxygen outlet. Number C, set up the intravenous line with 5% dextrose in water. Number D, set the radiant warmer control temperature at 36.5. وقف الفيديو هنا اختار الخيار بالشيء الصحيح. The correct option is option number B, connect the resuscitation bag to the oxygen outlet. ليه اخترنا الخيار رقم B؟ نشوف rational. The highest priority on admission to the nursery for a newborn with low Apgar score is the airway, which involve preparing respiratory resuscitation equipment and oxygen. So the correct option is option number B, which is connect the resuscitation bag to the oxygen outlet. The remaining option A, C, and D are also important, but they are of lower priority. So the correct option is option number. Question number 132. The nurse is assessing a newborn after circumcision and notes that the circumcised area is red with a small amount of bloody drainage. Which nursing action is most appropriate? The options are number A, apply gentle pressure, number B, reinforce the dressing, number C, document the finding, number D, contact the healthcare provider. وقف الفيديو هنا واختار الخيار بالشوف الصحيح. The correct option is option number C, document the finding. ليه اخترنا الخيار رقم C؟ نشوف rational. The penis is normally red during the healing process after circumcision, and the nurse will expect that the area will be red with a small amount of blood drainage. In addition, a yellow oxidate may be noted in 24 hours, and this is part of normal healing. Because the findings identified in the question are normal, the nurse will document the assessment finding. So the correct option is option number C. Regarding to the option number A and B, they apply gentle pressure and reinforce the dressing only if the bleeding were excessive. Will the nurse apply gentle pressure with sterile gauze? And regarding to the option number C, contact the healthcare provider. If bleeding cannot be controlled, the nurse will notify the healthcare provider. So the correct option is option number C. Question number 133. The nurse in a newborn nursery is monitoring a preterm newborn for respiratory distress syndrome. Which assessment findings should alert the nurse to the possibility of this syndrome? Select all that apply. بمعنى انك اختار كل ما ينطبق عليه الإجابة. ممكن تختار 1 2 أو 3 وأكثر. The options are number A, cyanosis, number B, tachypnea, number C, hypotension, number D, retraction, number E, audible grunts, number F, presence of barrel chest. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct options are option number A, B, D, and E. ليه اخترنا الخيارات دي؟ نشوف rational. A newborn infant with respiratory distress syndrome may present with clinical sign of cyanosis, tachypnea or apnea, nasal flaring, chest wall retraction, or audible grunts. So, the correct options are options number A, B, D, and E. Regarding to the option number C, hypotension and barrel chest are not clinical manifestation associated with respiratory distress syndrome. Regarding to the option number F, presence of a barrel chest, respiratory distress syndrome is an acute occurrence and barrel chest develop with chronic condition. So the correct options are option number A, B, D, and E. شكرا جزيلا ونتقابل إن شاء الله في محاضرة جاية. Don't forget to support us by comment, like, or subscribe.